As women journey through the various stages of life, especially into their 60s and beyond, the focus on health and well-being becomes increasingly important. One critical area that deserves special attention, but is often underestimated, is balance. Maintaining good balance isn't just about staying on your feet. It's about preserving your independence, safety, confidence, and overall quality of life. Unfortunately, balance issues are more common among women over 60 than many people realize, and they can lead to dangerous consequences like falls, fractures, hospitalizations, and a significant decline in day-to-day mobility. What may come as a surprise is that balance issues in older women are not always due to age-related conditions alone. Many of the underlying causes are linked to simple daily habits and lifestyle choices that may seem harmless, but gradually take a toll on the body. Things like skipping regular physical activity, wearing improper shoes, neglecting hydration, not consuming enough protein, avoiding balance training, ignoring posture, and even forgetting to have regular eye or hearing checkups can all quietly contribute to instability over time. This slow erosion of balance can creep up without warning, leading to feelings of dizziness, weakness, and lack of coordination. Many women attribute these changes to just getting older, when in reality, there are practical, actionable steps that can make a real difference. With just a few mindful adjustments to your daily routine, you can improve your balance, strengthen your core and leg muscles, boost your coordination, and significantly reduce the risk of dangerous falls. More importantly, taking care of your balance doesn't just help you avoid accidents. It helps you feel stronger, more energetic, and more confident in everything you do, from walking outdoors to doing housework, dancing, playing with grandchildren, or traveling. It's about living a vibrant, independent life without fear. In this guide, we'll explore the most common yet overlooked daily habits that could be compromising your balance, and we'll also share simple but powerful tips to help you regain stability and stay active for years to come. Whether you're already experiencing balance issues or simply want to stay ahead of them, the information here can empower you to take control of your well-being, because a small change today can lead to a stronger, safer tomorrow. Inadequate footwear choices, a hidden risk to balance. One of the most overlooked but incredibly important factors in maintaining good balance as we age is our choice of footwear. While it may seem like a minor detail, the shoes you wear every day can have a dramatic impact on your overall stability, posture, and risk of falling. This is especially true for women over the age of 60, whose feet have undergone natural structural changes over time. As we get older, the arches in the feet tend to flatten, and the natural padding that cushions the soles gradually diminishes. This can make walking on hard surfaces more uncomfortable, and can also reduce the foot's ability to absorb shock. Additionally, joint stiffness, reduced ankle mobility, and even changes in foot shape, such as bunions or hammer toes, can make finding the right footwear more challenging, but also more critical. Unfortunately, many older adults continue wearing unsupportive, poorly fitted, or unsafe shoes out of habit, convenience, or fashion. Shoes that are too tight can restrict circulation and cause pain, while loose or floppy shoes, like backless slippers or worn-out sneakers, can make it difficult to maintain balance, especially on stairs or uneven surfaces. According to experts, at the Mayo Clinic, one of the leading causes of preventable falls among older adults is inappropriate footwear. Footwear that lacks proper arch support, ankle stability, and slip-resistant soles can dramatically increase the likelihood of tripping or slipping. High heels, while stylish, shift your center of gravity forward and make you more unstable. Shoes with smooth or slippery soles can lead to dangerous falls on tile or hardwood floors, while soft, unsupportive flats offer little protection for aging joints and muscles. The good news is that choosing the right shoes can drastically reduce your risk of falls and improve your balance almost immediately. Look for shoes that offer firm, supportive soles that provide a stable base, non-slip treads or rubber outsoles that grip the floor, adequate arch and heel support to align your posture and reduce strain, a secure fit, not too tight, not too loose, with Adjustable straps or laces closed backs for ankle stability, especially in slippers and casual shoes. Lightweight materials that won't cause fatigue during walking. A wide toe box to prevent pressure on sensitive or arthritic toes. Athletic walking, shoes, orthopedic shoes, and even some modern sneakers with cushioning technology and balance-enhancing features can be excellent choices. Many brands now offer stylish yet supportive footwear options designed specifically for older adults who value comfort and safety. If you're unsure whether your current shoes are helping or hurting your balance, take a close look at their wear, patterns, and support structure. Or better yet, consult a podiatrist or physical therapist who can assess your gait and recommend footwear tailored to your specific needs. Making the simple switch to balance-friendly shoes is a small change that yields big benefits. Not only can it reduce your risk of injury, but it can also help restore your confidence in every step you take, whether you're walking around the house, shopping, exercising, or enjoying a stroll outdoors. Neglecting strength training, a silent contributor to poor balance. As we grow older, one of the most significant yet frequently ignored changes in our bodies is the gradual loss of muscle mass, a condition known as sarcopenia. This natural process begins as early as our 30s and accelerates with each passing decade. By the time a woman reaches her 60s, she may have already lost as much as 15–30% of her muscle strength, especially if she hasn't engaged in regular strength-building activities. This muscle decline doesn't just affect how strong you feel. It has a direct impact on your balance, stability, and overall mobility. Neglecting strength training means you're allowing your body to slowly lose the very tools it needs to keep you upright and agile. Strong muscles, particularly in the legs, hips, core, and back, are essential for controlling body movements, supporting your joints, and reacting quickly to changes in terrain or unexpected shifts in position. Without this muscular support, your body becomes more prone to wobbling, stumbling, and falling, even during simple daily tasks like climbing stairs, stepping out of the shower, or walking on uneven ground. Many older adults mistakenly believe that strength training is only for younger people or bodybuilders. However, this couldn't be further from the truth. According to fitness experts at Tom's Guide and numerous health organizations, engaging in low-impact, age-appropriate strength training is not only safe for older women, it's essential for preserving independence and reducing fall risks. The great news is that you don't need a gym membership or heavy weights to get started. In fact, some of the most effective exercises can be done right at home with minimal equipment and time. Here are a few beginner-friendly options that deliver powerful benefits. Resistance bands. These are lightweight, inexpensive, and incredibly versatile. You can use them for arm curls, leg lifts, and shoulder presses to activate and strengthen key muscle groups. Light hand weights. Using 1 to 5 pound dumbbells, you can perform controlled strength exercises that improve upper body strength, which supports better posture and coordination. Bodyweight exercises. Movements like squats, wall push-ups, heel raises, step-ups, and seated leg lifts are excellent for building functional strength without any equipment at all. Core training. A strong core stabilizes the spine and improves balance. Simple exercises such as seated knee lifts, pelvic tilts, or gentle planks can work wonders. For noticeable results, experts recommend doing strength training sessions at least 2 to 3 times per week for about 10 to 20 minutes each time. It's not about lifting heavy or pushing yourself to exhaustion. Instead, the focus should be on consistency, proper form, and engaging the right muscle groups. Even modest improvements in strength can lead to better coordination, faster reflexes, and more confident movement. In addition to improving balance, strength training also helps in increasing bone density, reducing the risk of osteoporosis-related fractures, enhancing joint flexibility, and boosting metabolic health. It also promotes better posture, which further reduces the likelihood of falls. Moreover, strength training is not just a physical tool, it's a psychological one. When women feel stronger, they often feel more capable and more in control of their bodies. This self-assurance can translate into increased daily activity, greater social interaction, and a better overall quality of life. If you're new to strength training, consider speaking with a physical therapist or a certified personal trainer who specializes in senior fitness. They can help design a safe, personalized routine that fits your ability and comfort level. In short, skipping strength training is like leaving your body vulnerable to the slow weakening effects of aging. But by dedicating just a small portion of your week to simple, targeted exercises, you can significantly improve your balance, stability, and physical resilience, ensuring you remain active, independent, and safe for many years to come. Overlooking vision health. Seeing clearly is key to staying steady. Vision plays a more vital role in balance than most people realize. Our eyes constantly send signals to the brain, helping it judge distance, depth, and spatial orientation. But as we age, changes in vision, such as reduced depth perception, narrowing peripheral vision, and decreased contrast sensitivity, can silently undermine our ability to stay upright and avoid hazards. When depth perception is compromised, it becomes difficult to judge steps, curbs, or uneven ground, increasing the risk of missteps. Likewise, diminished peripheral vision can make you less aware of nearby obstacles or moving hazards. Even something as simple as stepping from a carpeted floor onto hardwood can become dangerous when contrast sensitivity is reduced. What makes this issue particularly concerning is that vision changes often occur gradually, making them easy to ignore. Many people simply adjust their habits, squinting more often, avoiding going out at night, or turning on more lights, without realizing these are warning signs of deteriorating vision. To stay safe, it's essential to prioritize routine eye exams at least once a year. An optometrist or ophthalmologist can detect conditions like cataracts, glaucoma, macular degeneration, and diabetic retinopathy, all of which can affect vision and balance. Early detection allows for treatment or management before symptoms worsen. In addition, make sure your prescription lenses are up to date. Wearing outdated glasses can distort vision, especially when moving quickly or navigating stairs. Also, consider using bifocals or progressive lenses cautiously, as they can sometimes alter depth perception when looking downward. Simple changes around the house can also make a big difference. Ensure your home is well lit, especially in stairways, hallways, and bathrooms. Use nightlights in frequently used pathways, and install motion sensor lights for added safety. Use high contrast markings on stairs or steps to help the eyes quickly detect height differences. In summary, vision health isn't just about seeing well, it's about moving safely and confidently. By staying on top of your eye health, you're not only protecting your sight, but also significantly reducing your risk of falls and improving your overall balance. Ignoring medication side effects, a hidden danger to your stability. Medications are essential for managing many age-related health conditions, from high blood pressure to chronic pain and mood disorders. However, many commonly prescribed and over-the-counter medications come with side effects that can affect your balance. These effects are often subtle but dangerous, particularly for older women. Drugs such as sedatives, sleep aids, antihistamines, blood pressure medications, antidepressants, and diuretics can cause dizziness, drowsiness, lightheadedness, or blurred vision, all of which compromise your ability to walk safely and maintain balance. Even combining multiple medications, known as polypharmacy, can increase the likelihood of these side effects. Many seniors unknowingly take combinations that interact in ways that make them feel off balance, fatigued, or unsteady. That's why it's vital to regularly review your medication list with a qualified healthcare provider or pharmacist. Don't wait until you've had a fall or a near miss. If you're experiencing even mild symptoms like dizziness when standing up, a foggy head, or trouble concentrating, bring it up immediately. Ask your doctor, are any of these medications contributing to my balance problems? Are there safer alternatives or lower doses available? Can these medications be spaced out differently to minimize side effects? In some cases, simply changing the timing of your doses, taking medications with food, or switching to a different class of drug can dramatically improve your physical stability. Also, Avoid self-medicating with supplements or new over-the-counter drugs without professional advice, as they can interact with your prescriptions in unpredictable ways. Maintaining balance isn't just about physical strength. It's also about being alert, clear-headed, and steady. Don't underestimate how much your medication regimen can influence your ability to remain upright and safe. Relying on furniture for support, a risky habit in disguise. Many older adults develop the habit of holding onto furniture while walking through their homes. Whether it's grabbing the back of a chair, the edge of a table, or the arm of a couch, this may feel like a convenient way to get around, but it can actually be dangerous and unreliable. Unlike assistive devices designed for stability, household furniture can easily slide, tip, or collapse, especially if leaned on heavily or unevenly. And relying on furniture doesn't promote better balance. It often masks an underlying weakness or confidence issue that needs proper attention. If you find yourself regularly reaching for furniture, it's a strong sign that you should consider using a more reliable aid. Tools like canes, walkers, or walking poles are specifically engineered to provide balance support, distribute weight more evenly, and help reduce the risk of falls. There's no shame in using assistive devices. They are tools of independence, not symbols of weakness. In fact, many people feel more confident and move more freely once they adopt the proper mobility aid. Here are a few tips if you're new to assistive devices. Start with a professional evaluation from a physical therapist to determine which type of aid best suits your needs. Get fitted properly to ensure comfort and maximum support. Learn how to use the device safely. There's a technique to proper walking with a cane or walker that can improve your gait and posture. Also, consider rearranging furniture to create clear, wide walking paths at home. Remove unnecessary items that may tempt you to grab or lean on them. Install handrails in key areas such as bathrooms or stairways, which are far more reliable and safer than a wobbly side table. Ultimately, your home environment should support your independence, not create traps. Replacing furniture reliance with the right tools can greatly enhance your confidence, safety, and mobility. Avoiding balance exercises. Missing the most direct route to stability. Balance is not a static trait. It's a skill that can be practiced, trained, and improved at any age. Yet many women over 60 overlook the power of balance-focused exercises, either because they feel it's too late to start, or they don't realize how impactful it can be. In truth, balance exercises are among the most effective ways to maintain stability, prevent falls, and retrain your body to react quickly and effectively to unexpected movements. These exercises strengthen the muscles that keep you upright, sharpen your proprioception, your body's awareness of where it is in space, and enhance coordination and posture. And the best part? Many balance exercises are simple, gentle, and require no special equipment. Here are a few that you can try today. Standing on one foot. Hold onto a chair or counter and lift one foot slightly off the floor. Hold for 10-30 seconds, then switch sides. Heel-to-toe walk. Walk in a straight line by placing the heel of one foot directly in front of the toes of the other, as if walking on a tightrope. Tai Chi. This ancient Chinese practice involves slow, flowing movements that build both mental focus and physical balance. It's often called meditation in motion and is particularly beneficial for older adults. Seated leg lifts and core engagement. Strengthening the abdominal and leg muscles supports better control of your center of gravity. According to experts, from Hopkins Medicine, Silver Sneakers, and the NY Post, just 10-15 minutes a day of targeted balance exercises can yield noticeable improvements in stability within a few weeks. These routines can also boost confidence, improve posture, and enhance your overall sense of control while walking or standing. If you're unsure how to begin, many community centers, senior groups, or online platforms offer balance-focused classes specifically designed for older adults. Programs like Silver Sneakers offer free or low-cost virtual and in-person classes tailored to different fitness levels. Remember, avoiding balance exercises is like skipping the most direct route to fall. Prevention By committing just a few minutes a day to improving your balance, you're investing in your safety, independence, and quality of life. As we age, our bodies undergo natural changes, but losing balance and independence doesn't have to be one of them. The good news is that many of the factors that contribute to falls and instability are within our control. With awareness, intentional action, and consistency, women over 60 can significantly improve their balance, prevent falls, and live more confidently. Let's recap the key habits that can undermine stability and how to overcome them. Wear supportive, non-slip footwear to avoid accidents. Incorporate strength training to maintain muscle tone and joint stability. Schedule regular eye exams and optimize home lighting for clearer vision. Review medications that may cause dizziness or drowsiness. Avoid using furniture for balance. Use proper assistive devices instead. Practice balance exercises regularly to train your body and brain to stay upright and responsive. Every small change, whether it's 5 minutes of balance training, a new pair of supportive shoes, or an updated glasses prescription, contributes to a safer and more active life. You deserve to feel strong, secure, and empowered at every stage of life. So don't wait for a fall to make a change. Start today, even with one small habit, and you'll be taking a powerful step toward maintaining your freedom, mobility, and well-being for years to come.